Well, we're staying on development in Oyo State, where an explosion at the Adeyi Avenue in Old Bodija area has killed at least 2 persons and left 77 others injured. This figure is according to the Oyo State government. But we have joining us the Chief Medical Director of the University College Hospital, Ibadan, Jesse Otekbaye, to confirm this figure to us. Thank you for joining us on the news at this hour.
Thank you for having me.
It must have been quite tense for you since yesterday, but can you share with us your first-hand evaluation of the degree of injuries you've seen in these victims and if they are responding well to treatment?
Yeah, as at around 8 a.m. this morning, we had 11 patients on admission, and one patient that was brought in dead was put in the morgue. But as at this time, as we speak, we have 13 patients on admission, and one just moved to the intensive care unit, a child. The degree of injury starts from things as minor lacerations, that's tearing of the skin, to fractures of the lower limbs, and also some patients, at least 2, had a chest injury. One has a blunt chest injury, another one had a rupture of the lungs that led to air entering the wrong place in the chest. And that has had what is called chest tube passed to deflate the air that is in the chest that can compress the lungs and cause suffocation. Others have things like bruises on them. One had head injury, which is minor, like what we call concussion. There's an impact on the head that causes temporary pain in the head and also a kind of confusion, but they are all doing well. Of the number I gave you now, the 13 of them on admission are quite stable. Some of them are awaiting surgery by our orthopedic surgeons, another one by the cardiothoracic unit. So in all, they are doing very well. I've not got the full information about the child that was just moved into ICU because he just came in. I just asked one of our staff to go verify, because I also just came back from impact assessment visits to our buildings that were affected in the hospital.
Well, do you have other victims on admission in another hospital? Because the figure you are giving us right now is quite different from what the state government gave. As of yesterday, we heard that 2 persons were killed and 77 others were injured.
Yeah, certainly the figures will be different. I'm just giving you the figures at the University College Hospital, Ibadan. Some other patients were taken to private hospitals and other government hospitals within Ibadan metropolis. Particularly, I heard people mentioning Redeem Hospital. Some of the patients are there. I don't have the figures for that. My territory is University College Hospital. I can only speak about the numbers within the hospital here in UCH.
But we saw on social media's calls for blood donation. What's the latest as regards getting help for that? Are people responding?
Yes. For the University College Hospital, like I said, that I can speak categorically about, some of our medical students came out yesterday because one of the patients bled massively and had to be transfused with blood. So our medical students and some other members of staff came to donate blood. The patient has been transfused with blood and is still on admission and very, very stable, I assure you.
But then how have you
there
been
might
able
be
to...
others in other hospitals who have other degrees of injuries that I cannot comment on.
I understand you perfectly. I also want to know how you have been able to cope with, the pressure from family members of the victims. I also hear the governor was there till midnight yesterday.
That's correct. I got information that the governor was around about maybe 1 a.m. in the night because the explosion occurred around 7:44 p.m. yesterday. The relations are around, but they are well behaved and well controlled. We don't have any issues with the relations. I paid a visit there this morning up till about 9 a.m. and things are under control. And immediately that happened, we recalled our staff that were off duty on leave to come to our aid, and many other health workers came. And of course, we also activated our trauma response system, and all our staff have been helping to ensure that these victims of the victims of this explosion have the best of care. And of course, the governor of Oyo State has also declared that he will pay for the healthcare services that we will render. So as at this point, we have not asked any patient to pay. So we are standing on what the governor said, and we are treating the patient as appropriate.
Thank you very much, sir. We hope to get back to you on the state of health of some of the victims later on. Well, I've been speaking with the Chief Medical Director at the University College Hospital in Ibadan, Jesse Otegbayi. Thank you for joining us on the news at this time.
Thank you for having me. I appreciate you.
All right, coming up.